by the tornado fully recover and rebuild. Now, FEMA continues to accept applications for individual assistance at disasterassistance.gov. Over 3,400 Davidson County residents have registered with FEMA, and I urge anyone who has experienced storm-related expenses, including temporary housing, storm damage, and hardware, medical bills, moving and storage costs, to register now at disasterassistance.gov. Now, the Community Foundation of Middle Tennessee is continuing to disperse expedited grants to agencies providing emergency assistance to tornado victims and has raised nearly $10.6 million in pledges and contributions from over 21,000 donors to date. Now, over $2.12 million in grants has already been deployed from the fund to 60 nonprofits to help tornado relief efforts: Lee Chapel, AME Church, Gideon's Army, the Martha O'Brien Center. And the Community Foundation's Advisory Council is meeting again today to consider more than 20 additional grants, totaling more than $500,000, which the foundation will announce on Monday. To find a list of grantee organizations providing individual assistance to tornado survivors, visit tornadoresponse.com. tornadoresponse.com. Now, Kathy Floyd Buggs, the director of the Office of Neighborhoods, is leading a team from the mayor's office to work directly with our community partners to ensure that funds and other assistance continues to help those directly affected by the storm. Now, I'm incredibly grateful to every Nashvilleian who has responded with such generosity to help those affected by the March 3rd tornado. The week of the storm, more than 26,000 individuals signed up to volunteer with Hands On Nashville. That's more than volunteered in the 8 months following the 2010 flood. There was 4,000 more even 8 months after the 2010 flood, so that's just a remarkable and effective response. 700 disaster-related volunteer projects have been posted since March 3rd, representing more than 30,000 hours of service, and they are completed in the tornado response and recovery effort. Nashville has proved that it knows how to respond in a crisis, and now we're counting on you to do it once again. As we see positive cases of COVID-19 rise in our community and hospitalization rates increase, residents must do all they can, including remaining at home and practicing safe social distancing when running essential errands, to help flatten the curve of the coronavirus disease. Now, our thoughts are with those who are sick with the virus and the loved ones of those who have died. Flattening the curve means saving lives, which requires county-wide compliance with the Safer at Home order. Now, fortunately, a vast majority of residents and businesses are complying with the Safer at Home order and have been since the order was first issued. But those who choose not to comply will face fines and misdemeanor citations if they violate the Safer at Home order. Non-compliant businesses will face other consequences, including civil penalties, padlock orders, and suspended or revoked licenses and permits. Now, anyone can visit hub.nashville.gov or call 311 from anywhere in Davidson County or download the Hub Nashville app to report a suspected violation of the Safer at Home order, including non-essential business operations and unlawful gatherings. Now, this morning, I want to take a moment to extend my gratitude to all the hard-working individuals providing essential services in Metro government. From the clinicians and the epidemiologists at the Metro Department of Public Health to the first responders of the Metro Nashville Police Department and Nashville Fire Department, we could not successfully confront any crisis without our dedicated Metro personnel, and there are far too many today to list them all. Now, on behalf of everyone in Nashville and Davidson County at this month anniversary of the tornado, thank you for your dedication, your professionalism, and your hard work, especially over the past month. Now, I'm grateful to Dr. James Hildreth, President and CEO of Meharry Medical College, for joining us again this morning to provide his insight into the COVID-19 outbreak. from his unique perspective as an infectious disease expert. I'd also like to welcome Fabian Bedney from the Office of Neighborhood Development and Infrastructure and liaison to the Office of New Americans for joining us this morning to talk about the important work that the Metro Coronavirus Task Force is doing to inform our neighbors in Nashville's immigrant communities. And finally, I'd like to thank the Nashville Predators and team captain Roman Yossi for providing us with his encouraging words and a reminder to practice safe social distancing. A special message from Roman will be immediately following today's press briefing. Now, and as a reminder, anyone can visit covid19.nashville.gov to make a contribution to the COVID-19 Response Fund or find information on obtaining direct financial, food, housing, mental health, social service, unemployment, and utility payment assistance. And now I'll turn it over to Dr. Alex Jahanger, Chair of the Metro Coronavirus Task Force. Thank you very much.
Thank you, Mayor Cooper, and good morning, Nashville. Here's the latest information on the COVID-19 virus in our city. We now have a total of 808 confirmed cases. This is an increase of 23 cases in the past 24 hours. Yesterday, there was a sixth COVID-related death, a 60-year-old gentleman with underlying health conditions. Of the confirmed cases, 26 are currently hospitalized, 673 cases are self-isolating at home, and 103 people have recovered. You know, as I was looking through the data last night, I also wanted to let you know that there is an additional 780 cases in the Mid-Cumberland region, which includes the counties of Cheatham, Dixon, Houston, Humphreys, Montgomery, Robertson, Rutherford, Stewart, Sumner, Trousdale, Williamson, and Wilson. This means that nearly 1,600 of the 2,800 cases in the state are right here in Middle Tennessee. This is not just a national problem. As of 9 a.m., the community assessment centers open to screen residents who may have the virus. More than 700 people have been screened thus far, and nearly 500 have been tested. The centers, along with the assessment hotline, are part of the community assessment system that we have created for Nashvillians who are concerned about the virus. If you think you have symptoms, first call the assessment line at 615-862-7777. The hotline is open 7 a.m. to 7 p.m. 7 days a week. You will be connected with the medical personnel who will answer your questions and determine if you need additional screening. If you do, you will be referred to either your local healthcare provider or to one of our community assessment centers. These drive-through centers will provide additional screenings and, if needed, a COVID-19 test. As I've mentioned before, the purpose of these community assessment centers in our system is to increase access for the services to our residents and also to lessen the burden on our community hospitals. We are also planning to help ease the pressure on our community hospitals in anticipation of the surge of the COVID-19 patients that as the incidence continues. Yesterday, it was announced that the Music City Center will be one of the regional alternative care sites for the state of Tennessee. It will have over 1,000 beds to support the anticipated surge of COVID-19 patients. The Nashville Coronavirus Task Force and local healthcare systems have been involved from the start and will assist the operation of this site. Later today, the mayor, the task force, and representatives from regional hospitals will meet by phone, of course, with state officials to continue planning on the alternative care sites. This is a regional facility and will support the hospitals in Davidson County and our surrounding counties. If you would like to help with the alternative care sites, please sign up for the Tennessee Medical Reserve Corps. We need medical professionals as well as others who have an interest. There's a link for the state signups on our website, covid19.nashville.gov. Yesterday, Governor Lee amended the state Safer at Home order, and you may have seen other cities in the region do the same. I thank the governor and the area mayors for having issued an order like we have done here in Nashville several weeks ago. It is going to take a broad approach to combat this virus, and every step is important. For Nashvillians and all those watching this morning, the main thing you need to know about this order is stay at home. I continue to need your help. Social distancing and staying at home can help stop the spread of this virus. Tell your friends and family, tell them to stay at home. Stop going out for unnecessary purchases and unnecessary errands. Stop gathering in parks or stores or other public spaces. And stop going out when you feel sick. As I've said before, please spread the word and not the virus. I now would like to introduce Dr. James Hildreth, the president of Meharry Medical College. My apologies.
Good morning, Nashville. A short while ago, one of the top scientific journals published a paper that showed that 4 out of 5 people who get COVID-19 get it from someone who has no symptoms. This represents a major obstacle to putting the pandemic behind us in a short order. But let's imagine a different scenario. Let's change the receptor for the virus to a protein called NTCP, which is found in the liver. Now, instead of infecting the lungs and causing pneumonia, this virus would infect the liver and cause the liver to not function. Among the many things the liver does, it recycles red blood cells and the chemicals and proteins in them. One of the byproducts of this is a bile acid called bilirubin. It's a yellow-orange dye that, when it accumulates in the blood, it gets distributed all over the body, and it turns the skin and the whites of the eyes yellow. That means that it'd be easy to spot someone who's infected. We just look for those with the yellow eyes. We could quarantine them, get them medical assistance, and we know to stay away from those individuals to avoid contracting the virus. In this scenario, it might also be possible to start treating these individuals early for better clinical outcomes. Unfortunately, there are no yellow eyes or any other outward indication that people are infected early on in the process. This is why social distancing and the other things we've talked about are so important. So is there anything else we could do, absent the yellow eyes or some other indication? Well, there is. We could test everybody. But as you know, that's not possible because there's a national shortage of supply of testing kits, not to mention the logistical challenges of doing this. So in the absence of yellow eyes, some other indication, absence of widespread testing, is there anything else we can do besides sheltering at home? Well, yes, there is. All of us could wear a mask when we're out in public. Let me emphasize, and this has to be emphasized, the healthcare providers on the front line must have the highest priority for personal protective equipment. That said, there's a reason why in China and South Korea, everyone wears a mask when they're out in public. And at least one major study showed that cut the rate of transmission by 50%. Combining the wearing a mask plus the other things that have been done probably accounts for the better outcomes in those countries than in other countries. Now keep in mind that masks serve 2 purposes depending on who's wearing them. They can reduce the risk of getting the virus from someone who's infected. They also reduce the risk of transmitting the virus from an infected person to an uninfected person. What that means is that if everybody is wearing a mask, regardless of who had the virus, the chain of transmission would be reduced. If COVID-19 gave us a clear signal early on of who's infected, we would need to take this approach. If we could text everyone to see if they had COVID-19, we would need to take this approach. Since neither is the case, it's probably time to add another major effort to controlling the virus. And that probably is that when you go out, and only if you go out, have to go out, that you wear a mask. There's a national urgency, and I'm going to repeat this, that the PPE must be reserved for healthcare providers and those on the front line. So many people have resorted to making homemade masks out of bandanas and other kinds of materials. There are a couple of things you really need to know if you're doing this. If the mask has served its purpose, there's every possibility it's contaminated on the outer surface. What that means is that you should do 2 things. Wash your hands when you take it off and sterilize it or sanitize it if you're going to use it repeatedly. If possible, wash it in soap and water, and if it's made out of cloth or has no metal staples in it, you can do what I do. Stick it in a plastic bag and microwave it for 2 or 3 minutes at the high setting. Numerous studies show that many types of bacteria, fungus, and viruses are killed by microwave radiation. You must make sure that your improvised device is compatible with microwaving, and if it is, stick it in a plastic bag and zap it for 2 or 3 minutes at the highest setting. I want to emphasize, as you heard earlier, that our best strategy still for controlling the virus is to stay at home. My heart breaks every time I hear a news story about a nursing home where the people have gotten infected. The virus is not floating in the air. Someone delivered the virus to that facility. That's how it started. Someone was a vector. Please stay at home. Comply with the order to stay at home. Only go out when you absolutely have to. And if you have to go out, please cover your face to avoid becoming a vector. And now I'd like to introduce Fabian Bednay. Thank you.
Thank you, Doctor. Good morning, everybody. Buenos días. The Metro departments, from police with El Protector, schools with the EL department, the health department, Metro Action, and others, are engaging new Americans in their languages with an effort to be culturally competent. For example, the COVID-19 hotline offers Spanish-speaking nurses and public health professionals. It also uses Language Line as a translation service that allows our call takers to communicate, including our Kurdish population and others that call the hotline. The hotline, by the way, is open from 7 to 7 every day. Social distancing information excuse me, and available services are translated and shared with the help of the various communities' established channels. Signage, flyers, advertising, and a variety of media, including social media, has been translated and shared. Our website includes a tab where the same information is constantly updated in Spanish and other languages. I am very happy and proud to host a morning call with Spanish language media where I provide updates on the current efforts, guidelines, and answer questions that help the Latino community be aware but mostly be safe. Engagement has been done with residents from various backgrounds, for example, Somali, Kurdish, Latino. The Mayor New American Advisory Council connected us with volunteer translators to help us share the information in other languages as well. Lastly, anybody wanting to share a unique need that New Americans may be facing, please email us to newamericans@nashville.gov. Please be safe. Por favor, cuídense. Thank you very much. Muchas gracias.
Thank you, Dr. Hildreth. Thank you, Fabian. We will now start the Q&A portion of today's briefing. I will announce your name from the podium, and you may proceed by asking your question over the air. We'll start with Jeremy Finley at News 4. Jeremy?
Good morning, and thank you again for providing all this information on this very quickly developing situation. I had two questions this morning, one of them being, and Dr. Hildreth kind of talked about this, but there's so much discussion now about masks and making masks and wearing masks. The question is, should fabric stores be added to the essential list of businesses that can be open so people can buy and make their own masks? That's one question. The second one has to do with something the sheriff said yesterday at his news conference. While he in no way is complaining about the assessment centers, he said in his observation the assessment centers aren't being used as much in comparison to the people that have come in contact with someone that has been in contact with someone who may have symptoms. And so his correctional officers and his inmates. So the question is, should those assessment centers be opened up to people that may not have symptoms but have been exposed to someone with symptoms, like nurses and correctional officers? Thank you.
Thanks, Jeremy. Dr. John Gear?
Thank you, Jeremy. I was just conferring with Dr. Hildreth regarding your first question. We don't believe that fabric stores should be made essential for the purpose of making masks as of this moment. Obviously, we're constantly evaluating any data, and that's everything subject to change. Regarding question regarding, I did not hear what the sheriff, I believe you said the sheriff made a statement. I'm sorry, I didn't hear that. But the assessment centers protocols on who is tested is based off of the criteria and in conjunction with the expertise of all our health systems around our region and CDC guidelines. So the assessment center is available to all Davidson County residents who meet certain criteria. Now, if somebody is, I believe your question, if somebody had a first encounter with somebody as a healthcare professional, for example, my wife or kids who are encountering me, right now the guidelines do not say that person needs to have tested. Now, if I were tested positive, then I believe the criteria may have that my significant other or people who are close to me would be tested. But just to test somebody who's had an interaction with someone who's a higher risk category is not indicated and not necessarily the right thing to do at this moment. Thank you.
Next, we have Stephen Elliott with the Nashville Post and Scene.
Thanks, Chris. Since the state of Metro is wondering what sort of additional deliberations and information you've gathered about the revenue projections and the budget that you'll be submitting, if you could give an update on that.
Mayor Cooper.
Thank you, Stephen. Welcome to my afternoon. The data that's coming in, and also understanding the federal response has to come in. Treasury Department regs have to be written and read and interpreted. So we don't have enough information right now to be able to answer that question. Thanks.
Peter White with the Tennessee Tribune. Mr. White.
Hi, Dr. Hildreth. I have two questions. One is just a source for the study that you mentioned in your brief talk, if you know it. And secondly, it's a question about epidemiology and the curve. What is your thinking on the predicted date, which is, I think, the end of this month, for it to peak? But if we're not testing as the best science would require, how authoritative is that date for a peak? I mean, maybe it's wildly off, maybe it isn't. I don't know.
Thank you, Peter. Dr. Hildreth.
The paper I referred to is published in Science. It's Lee et al., and it's the March 16th issue of Science, which, as you know, is one of the top journals in the world. I think it's too early for anyone to precisely predict when the peak is going to occur. We just need much more data. So I'd be stepping out of my role as a scientist to say we know that. We just need more data. And that's why these testing centers are so important.
Harriet Wallace, Fox 17. Go ahead, Harriet.
Hi there. Good morning, everybody. And Chris, if you'll allow me, I do have a couple of quick questions. The first one is the most brief. This one is for Dr. Hildreth. I just wanted to clarify, or at least confirm, you had mentioned, because I know a lot of people want to know this, did you say putting your face mask, if you have to reuse it, putting that in the microwave for 2 to 3 minutes? Could you just confirm that, or were you speaking of something else?
I'm referring to the improvised face covers that people are using, bandanas. My wife made hers out of an old T-shirt. So if you're going to make an improvised device out of some kind of cloth material, an easy way to sanitize it is to wash it in soap and water or stick it in a plastic bag and zap it for 2 minutes in the microwave. I'm not referring to the professional PPEs that you buy. Many of those have metal staples in them, which of course cannot be put. And those are meant to be one-time use and throw them away.
Harriet, you had some follow-up questions?
Yes, I do. And again, Dr. Hildreth, thank you for being my Dr. Oz today. I appreciate it. This message, or this question is in regards to the shelters. My first question is, what is being done, kind of to Jeremy's question, how are we managing the homeless population that really do not have a home to shelter in at this time? I know that there is the shelter set up, but how are we managing movement of them throughout the day to help contain any chance of spreading the virus, as everyone else who does have a home has a place to stay in? And what protective gear is or will be provided to those who are managing that facility? My second question is in regards to the Music City Center. Dr. Jahanger, how soon do you anticipate us needing this facility, and will we have enough medical personnel to man them? Because if it's gotten so out of control, then I would assume that the hospitals can no longer manage it. How are we going to have enough medical personnel to maintain that facility? And that's all. Thank you.
Thank you, Harriet. Dr. Jahanger.
Thank you so much. In regards to the shelters, as we've mentioned, there are 2 facilities currently at the fairgrounds that are operational. One is for unhoused individuals who are well, so no evidence of any kind of illness. It allows them to safely social distance, has a lot of ability to wash your hands, bathe, laundry your clothes, food, entertainment. So that's one shelter for individuals who are unhoused and would like to have those facilities. There's a second shelter for individuals who show signs of illness, may not necessarily be positive for the disease. Again, proper CDC guidelines and Dr. Caldwell and the health department guidelines of how they are placed. Regarding the PPE and so forth that individuals who are working in the shelters wear, will follow whatever guidelines are indicated. Typically in the second shelter I'm referring to, mask, gowns, etc. There's also once and if, and I think it's more of a once, not an if question, a statement of if somebody, our unhoused population, a certain number of them test positive for the disease, then we will have a larger facility, but we're not at that point today. Music City Center, question of when we think we need it goes to Dr. Hilder's statement. Modeling's hard, and I don't say that to say we're not doing it. It's a prediction, and it depends on data. And in fact, at 10:30, I have a call with somebody who's doing some modeling, and I've spoke with someone different who's very smart doing modeling, and I've spoken with all their hospital systems about modelings they're using. It's hard to predict. Looking how the numbers are right now, right after I just told you it's hard to predict, our worry is 3 weeks from now is when the surge may hit. 3 weeks from now, if this doesn't happen, I am happy if you guys told me I overreacted. But you know what we don't want to do as a community is not be prepared for a wave that may happen. And I can take all the criticism for overreacting, and that's great. So our best guess today is 3 weeks from now, 4 weeks from now is when the surge may hit our community. Your staffing question is an excellent one, and one that I know the mayor and I, and last night I spoke with several hospital executives and people in the State Department of Health. We have this question, and I know the mayor spoke with Director McWhorter for the Unified Command about this exact question. We're working with the state. This is a state responsibility at the end of the day, staffing. There's some staffing models that we're working through, but I think what is critical is however this is staffed, it does not take away from our current hospitals that are providing some great care, and so you bring up a great point that we're working through, and I hope we have a good solution for it. Thank you.
Damon Mitchell, WPLN. Go ahead, Damon.
Hi, Chris. Just one quick question. Is there a number or anything as far as like fines and citations that have been given out? Can you just kind of provide an update on how that's going?
The question is how many fines and citations and numbers around that?
Yeah, okay.
Dr. Caldwell.
Thank you. Good morning. I can tell you that Hub Nashville and COVID-19.nashville.gov is getting lots of inquiries. There are 2 buttons right there if you go to the Safer at Home order, where you can submit a request or let us know about a violation. Over the last 2 days, there have been probably about 60 specific violations that were reported to us. About 90% of those, when we went out, seemed to be in compliance. We're following up on about 10% of those. Right now, everyone that we have gone to talk to, owners, those running the stores, have complied. There are a couple that we are still following up with because when we visited them, they were closed. So please keep your questions coming to that Hub Nashville, or let us know if you see a violation, and we will be responding. We have teams with the Department of Health inspectors as well as Metro Police going out, and we are responding to complaints, but we're also patrolling the neighborhoods as well. And we have also great partners across Metro government and you who are helping us to remind people that you shouldn't be standing close together in the parks. Keep your distance, and we'll all get through this together. Right now, no fines. Thank you.
Nancy Amons.
Hi, I'd like to follow up on something I heard just a minute ago. Did you say that the Music City Center is going to be staffed by the state? Is Unified Command responsible for providing the staffing for that? And also, can you answer a question about this new 5-minute test? Does it use new equipment that has to be manufactured, or would it be able to use existing equipment, things that are common in a doctor's office or maybe a walk-in clinic? Thanks.
Dr. Jungier.
Sure. Nancy, thank you, and good morning. I'll answer the first question. Yes, the state and the Unified Command are the point for staff of that facility. It's their responsibility for the state response, but we as regional people will work with them and make sure it's a plan that makes sense for our region. And I'll let Dr. Hildreth give you some insight regarding the 5-minute test. Thank you.
The main way that the virus is detected is by looking for nucleic acids, the genetic material, through a process called polymerase chain reaction. That involves machines that take temperatures really high, bring them back down low again, and those are fairly substantial machines. The Abbott device is about the size of a toaster. It does all this at the same temperature. It's called isothermal PCR, and those machines are the ones that do this in 5 minutes and a negative result in as little as 15 minutes. So I believe that Abbott is manufacturing these things as fast as they can, but those can be point-of-care devices in walk-in clinics, doctor's offices, so that's going to be transformative to getting more tests done. But it's a very exciting new development in terms of testing.
Nikhil Smith, WKRN.
Good morning. Thanks for taking my questions. A couple of them. The first one is regarding the Music City Center. Is there a timeline as to when the build-out itself will be completed? And what exactly is Metro's role in getting that fully completed? And then I had a question for Chief Swan as well. The Nashville Firefighters Union says that if people are calling 911 because they have symptoms of COVID-19, they should probably if they have someone that could take them to the hospital using a personal vehicle, that they should do that instead. So, Chief Swan, is that a directive that you would support as well?
Let's start with Dr. Jungier.
Hey, thanks so much. So the questions are all excellent around the Music City Center. In fact, this afternoon at 2 o'clock, the mayor and I and others are having, as I mentioned, a meeting by phone with regional hospitals leadership, as well as highest level of state health department and so forth leadership, to find out exactly whose responsibility every one of these things you're asking is about. How long will build out take? Staffing, who will do what will our response and responsibilities be? This is a big deal, right? You're putting a hospital that's 1,000 beds or more, and when we're working through that, but I assure you that we're gonna make sure that the plans are solid, and everyone who takes responsibility for the parts that they need to take responsibility for. And I'll defer to Chief.
Good morning. So the question in regards to someone needing to get tested, are feeling as if they have symptoms of the COVID-19. As you know, the 911 system that we operate under is exactly for that. That's for emergencies. So if anyone has an emergency, then they are to call 911, and they're expecting for us to respond and treat our citizens as we're sworn to do, and that's exactly what we will do. But again, that's why we've got these assessment centers set up. So if an individual is not an emergency, meaning that they're at a level where they cannot transfer their self or of something of this nature, it would be appropriate if they have the transportation to drive their self to one of the assessment centers or to their own physician as far as that goes. But if it's an emergency and they call 911, they expect us to show up, and that's exactly what we'll do. Thank you.
Thank you, everyone. There are no live COVID-19 press briefings scheduled for this weekend. We will continue issuing updates by email to local media each morning, and all Davidson County residents can visit covid19.nashville.gov to read about any new developments. Broadcast press briefings will resume on Monday, April 6th at 9:30 a.m. And now, a word from Roman Yossi and the Nashville Predators.
Hey guys, it's Roman Yossi, just checking in. We're practicing our social distancing at home, spending a lot of time with our furry friends, as you can see. Just hope everyone is safe out there. Take care of each other. Please listen to our doctors. Practice as much social distancing as you can. I know this is a difficult time, but we're all in this together. And yeah, do as much as you can and stay at home as much as you can. Also want to thank all our doctors, nurses, grocery store workers, first responders, police officers, everybody that's still out there trying to keep everyone safe. You guys are the real heroes. And yeah, I hope I see you guys soon at Bridgestone. But till then, take care of each other and please be safe.
All right, Roman Yossi right there, Nashville's Predators captain. Real quickly, I wanted to recap. So the very latest now, we're being told in Davidson County alone, specifically Davidson County, now 808 confirmed cases, 23 confirmed cases just over the last 24 hours. Sadly, we now have a sixth death to report here for Davidson County, a 60-year-old man who had underlying problems. Good news, 103 people have recovered. I want to quickly hit on this because we're already getting lots of questions, a lot of people writing in. What you were just hearing was this new study, 4 out of 5 people with COVID-19 are getting the virus from someone who does not have symptoms. So now they are asking all of us, if you have to go out, they ideally want everyone to now be wearing a mask. Now, granted, they're talking about stuff made out of material, not these high-end